It's funny how something as small as a bunion
Hmm.
can really throw a wrench in your day.
Yeah.
Those little aches and pains, they can really cramp your style.
Yeah, absolutely.
And while a lot of people just kind of grin and bear it, we're going to dig a little deeper today and see what's out there.
I like it.
So we're diving into the world of minimally invasive bunion surgery today, and we're turning to the experts over at New Jersey foot surgeons to help us navigate.
Okay.
And right off the bat, their tagline is advanced care, proven results,
Hmm.
which I have to say, pretty bold statement.
Yeah.
But then you start reading these
Yeah.
patient testimonials on our website
Yeah.
talking about walking pain-free for the first time in years.
Yeah.
And it really gets you thinking.
It's amazing, isn't it, how much a bunion can impact your life? Essentially, what's happening is the bones in your big toe joint, they start to shift out of alignment.
Okay.
And you get that bony bump that we all know and love. And as that big toe starts leaning over towards its neighbors, it's like, ouch. The pressure, the inflammation, it really makes itself known.
And New Jersey foot surgeons, they dedicate a whole section of their website to the latest and greatest in addressing this, specifically their minimally invasive approach, which they say offers improved outcomes.
Yes.
Now, of course, you know me, I got no more.
Right. Of course.
What's the story there?
So traditionally, bunion surgery, we're talking larger incisions, longer recovery, and nobody wants that.
Yeah, ouch.
Exactly. Minimally invasive techniques, though, this is where things get exciting. Specialized instruments, smaller incisions, and that means a much faster healing process. Think like up to 8 weeks versus month.
Wow.
Less pain, less swelling, and get this, less scarring.
Okay, now less scarring. That is a big deal.
Absolutely.
Especially, for anyone who's ever looked at those post-surgery photos and been like, wait a minute, my feet won't look like that.
Right, exactly.
But this all kind of begs the question, is surgery even the right call for everyone?
That is the million-dollar question, isn't it?
Yeah.
Because surgery isn't a one-size-fits-all solution.
Okay.
It's about figuring out what works best for your unique needs and your lifestyle.
And New Jersey foot surgeons seems to get that because they actually pose some really pointed questions on their website. And I'm curious, from your perspective, as I ask them.
Yeah.
Does your bunion actually hurt?
Hmm.
Or is it more of an aesthetic thing? Have you found yourself kind of like, avoiding activities you love, or maybe even sidelining those fabulous shoes in your closet because of it?
Those are such good questions to be asking yourself.
And speaking of getting the full picture, they have this whole before and after surgery section on their website. And
Yeah.
I know we can't, share visuals on a podcast,
Right.
but trust me, the transformations are pretty striking.
Oh, for sure. I mean, seeing those results firsthand, it can be so impactful, especially, for those who are visual learners.
Yeah,
It helps to actually see that improvement is possible.
absolutely. And that leads us to the person who might be behind those transformations, Dr. Nick.
Mm.
Their website features him prominently, and his bio highlights some pretty impressive credentials. Board certified, specializing in reconstructive surgery, and a clear focus on these minimally invasive techniques we've been discussing. What does reconstructive surgery even mean, in this context?
That's a great question. So when we talk about reconstructive surgery with bunions, we're talking about procedures that are designed to restore the natural alignment and function of your foot. So it's not just about like lopping off the bump. It's really about addressing like those underlying structural issues that cause the bunion in the first place.
So it's about getting to the root of the problem,
Exactly.
not just addressing the symptom, which makes a lot of sense. And something else that jumped out at me was fellowship trained.
Mm-hmm.
So what does that tell us about Dr. Nick's, expertise in this area?
Yeah. A fellowship is kind of like, like the cherry on top, if you will, of a surgeon's training.
Okay.
So that means after medical school, after residency, Dr. Nick went on to pursue additional highly specialized training in a very specific area of surgery. And in this case, it means that he has that advanced expertise in foot and ankle surgery, really going, above and beyond the standard qualifications.
So we're talking like next level specialization experience.
That's
That's reassuring, especially if you're, considering entrusting someone with, your feet.
For sure. And it's really interesting. Even though these minimally invasive techniques are, relatively new, they're not just for minor bunions.
Right. A lot of times they can be used for a wide range of severity.
Oh, wow. So even if someone has been living with a really severe bunion for years, maybe thinking surgery just wasn't an option for them, Dr. Nick's approach, this could actually help.
Exactly, yeah. And I think this is really where those advancements in, you know, technology, surgical techniques, it really shines because it opens up possibilities for people who maybe thought they had, no other recourse.
Wow. That's incredible. To think that even people with those, like, more severe bunions might have options they hadn't even considered.
It really is
I
amazing.
mean, it really speaks to how important it is to stay informed about these, medical advancements.
Absolutely. Knowledge is power, right?
Mm.
And especially when it comes to our health.
Yeah.
Taking the time to really understand our options can be, life-changing. Totally. And speaking of which, New Jersey foot surgeons, they offer free virtual consultations,
Right.
which is huge, especially for something like bunion surgery.
It's incredibly valuable because it gives, Dr. Nick a chance to really understand each patient's concerns. What are their goals? It's
Yeah.
about creating that, that personalized roadmap for treatment.
Mm,
And whether that involves surgery or, more conservative approaches,
right.
it's about finding what's right for them.
It's like having a direct line to like a leading expert in the field,
Yeah,
all from the comfort of your own home, which I love. And, it's interesting when we think about the impact of something like a bunion. It's not always just like the physical discomfort with it.
absolutely. Think about all the things that, people put on hold because of bunion pain, like walking, hiking, even just like wearing a favorite pair of shoes.
Right.
These things impact like our social lives, our hobbies, just our overall well-being, right?
Totally.
And that's why I think Dr. Nick's focus on, not just fixing the bunion, but actually restoring quality of life, helping people get back to doing the things that they love,
Yeah.
it really resonates.
It's about reclaiming those like little joys, the essential parts of, who we are. And
Yeah.
sometimes a minimally invasive procedure, that could be the key.
Absolutely.
So if any of this has resonated with you today,
Hmm.
if you're like nodding along, head over to the New Jersey Foot Surgeons website. Check it out. They have a ton of information. And of course, those free virtual consultations, just a click away.
Yeah.
Fantastic resource for anyone who's, ready to take that next step, explore those options, and really, start down that path towards a more, active, pain-free life.
Sometimes that's all it takes. Just that first step.
That's it.
Well, thanks for joining us for this deep dive into the world of minimally invasive bunion surgery. Remember, knowledge is power,
That's right.
and taking charge of your health, well, that's one of the most empowering things you can do.